violence and the human trafficking.
Yeah, that's fine. Yeah, so let's do EA station. I shared some years things, so we can do one of them. Yeah.
Yeah.
So all of them same approach. You don't need really, like last time you asked in the group, what's the difference between labyrinthitis and vestibular neuritis? It doesn't matter. So yeah, station, all of them same approach. You will ask your senior and you will give differential rather than name it.
Okay, if I am not able to diagnose it properly, then I will
able, even if it is 100%, we know this is Meniere disease, put it as your professional diagnosis, but also put DD with it. They don't like you to know the diagnosis straight away, and also in EA station they all overlap with each other. You can't be certain. A specialist can be certain, but for you as a junior doctor, you can't be 100% certain. So just you give it as possibilities. For example, 2 DD, if you can make them only 2, and then speak about further investigation, speak about refer to specialists, speak about speaking to your seniors before referring. So this can cover it like this.
So if I say that I have some differentials in this figure, but I'm not sure about it.
No, don't say I'm not sure. No. So the thing that like this is really good tips to learn for BLAB 2. You have to be confident, never show the patient, especially the examiner knows that you are a junior doctor, you don't know. But even when you start practicing, never show the patient that you are not sure. This is very critical. Just say the symptoms you are having, or from my assessment, there could be some few possibilities causing this problem. One of them, for example, is Meniere disease, because this is your top DD. So one of them is called Meniere disease. But
okay, how should I say? Please. I want to write it down. How should I say?
Yeah. So like from my assessment and the information you have given me,
the info and the examination.
Yeah, just from my assessment include history and examination, or you, whatever, or you're from the information you're giving me an examination. It's up to you. Just it means like so far, what you did so far. From my assessment, there could be some few possibilities.
Okay.
Yeah, causing your problem. Okay, so there could be some few possibilities. One of them is a condition, for example, called Meniere. If you think the diagnosis, most likely 199% is Meniere disease, because it shows very similar symptoms like the one you explained. However, to be certain, I will need to ask my senior to come and review you, and also we will refer you to the specialist for further assessment.
I'm going to be certain. I need to inform my senior.
Yes, you can say this, yeah. And also in the EA station, speak just about symptomatic treatment. Like if they have dizziness and vertigo, so you will give antihistamine. If they have pain, we'll give painkiller. So you don't need to name the treatment. We will give you some medication for your dizziness or for your vertigo, called antihistamine. And we will also give you some painkiller for the pain you're having. Yeah. And you have safety netting, like don't, if they have dizziness or balance problems, so don't drive, swimming without supervision, this kind of things. Yeah, like safety netting.
Okay.
Yeah, and all the approach for all of them is the same. You will ask all ear problem, including CNS problem, like vision problem, hearing problem, and vertigo, balance problem.
Okay, can we do one station?
Yes, sure. You are FY2 in DB clinic. John, 40 years old, has come with some hearing problem. Please do full assessment, manage him and address his concern.
FY2 in the GP department, John, 40 years old. 40?
Yeah.
Okay. With hearing problem. Okay.
Hearing, yeah.
Okay, I can start.
All right.
Begin.
Hello, this is Dr. Kabir. I'm working as the FY2, and my GMC number is 7762077. So, what should I call you?
Call me John.
Okay, John. So, can I confirm your date of birth, please?
I don't know my date of birth. I'm 42.
Okay, you're 42. So, also, John, how can I help you today?
Doctors, I have some ear problems.
Okay, and what you mean by that?
So I have some pain in my ear for a very long time, actually, like it comes and goes. And also I started to have some hearing problem. It also comes and goes, but it's getting worse. Like every time I think my problems going worse.
So you were telling me that you have this pain. So how long have you been having this pain?
I think it's 6 months now.
Okay, and how did it start?
It started just all of a sudden.
Okay, anything that makes it better or worse?
No.
And have you tried anything for that? For the pain?
Yes, I had some paracetamol, but it's not helping. Yeah.
Okay, and apart from the pain, you are having this hearing problem, isn't it? And it is increasing day by day.
Yes, true.
Okay, I'm going to ask you some few other questions. Just hang on with me.
All right.
So do you have this, do you feel like your head is spinning?
Yes, I do. Yeah, the room, my head is not spinning, but the room is spinning around me.
Does it happen all the time?
No, it comes and goes as well.
Okay. And do you feel like any weakness in any part of your body?
No.
Okay. And do you have any rash
No.
or anything else? Okay. And apart from this, do you feel like you need to vomit?
Vomit. Yes, sometimes I feel sick. Yeah, when I have this dizziness, I also feel sick. I don't vomit, but I feel sick. Yeah.
Oh, that sounds quite distressing for you, isn't it?
Yeah, it's very distressing when it comes to these episodes. Yeah.
Yeah. So, what you do for a living?
I'm a taxi driver.
Oh, and how are you coping with it? For example, you are telling me this, you have this dizziness and you drive the taxi.
Yeah, when I have the episode, I don't drive. I don't go to work.
Okay, I appreciate that. I appreciate that you can understand. Okay, apart from this, any past medical conditions you would like to tell me?
Not I'm aware of anything. No.
Okay, did you have any sort of fever or any loss of weight or appetite?
Fever. No.
Any lump or bump in any part of your body?
No.
Okay, so are you allergic towards any condition?
Sorry.
Are you allergic towards any condition?
No.
Okay, so who do you live with, John?
I live alone.
Oh, I'm really sorry to know that. So you don't have any family member, isn't it?
Why you assume I don't have family member? I have parents. I have brothers and sisters, but they all live away, far away from me.
Okay. So just this is just part of the procedure, to make sure that everything is all right with you. Okay, John, can we talk about your lifestyle? Is it okay for you?
Yeah, it's absolutely fine. Yeah.
So do you drink or smoke?
Not really.
Okay, and so John, in this part, what I'm going to do, I need to examine you. Okay, John, and I'll be also examining your ear and doing some relevant investigation, some neurological investigations also, tests also. So is it okay for you, John?
Yeah, it's fine.
Any findings?
No.
Okay, what's most important from the things that you have told me, John, and from
Did you
my
want to do a hearing test?
yes, I was going to tell you, John, that we are going to also do some test. It will be some hearing test so that we can
Yeah,
assure
so
that
he
is
has
there any
sensory neural hearing test.
okay sensory neural hearing loss, and we need to do look for into the ear, look into your ear by this simple machine. We call it otoscope.
Normal.
Anything else?
Normal.
Okay, otoscope normal. Okay. Well, so on the according to our assessment, John, and the symptoms that you are telling me, I have some possibilities. Are you getting me, John?
Getting you in what? You didn't tell me anything now.
Okay. Yeah. It is called Meniere's disease, but in order to be sure, we need to involve my senior. Do you have an idea about it regarding the Meniere's disease?
No.
Well, it is one of the diseases that occurs within our ear, and it causes basically this kind of hearing problem and balance issues. So, are you getting me, John?
Yes, but you didn't ask me about balance.
Yes, you were telling me that you have this dizziness. So when you are having this dizziness, it will cause you a little bit of trouble, isn't it?
If you think so, doctor, you know better than me.
Okay, I'm sorry for that. Okay, John. So let's talk about what you can do in this regard.
Okay.
Okay, as we're going to refer you to one of the ENT specialist. Okay, he's going to further investigate you. He may do some other test apart from the baseline investigations. For example, complete blood count, urine, electrolyte, as well as creatinine, and the infection markers. We'll be looking through these things. And if any special investigation is needed, he may run through those tests. So, John, are you getting me?
Yeah.
And as you have told me that you have this vertigo, we'll be giving you some of the medications and also for your pain. So, John, are you getting me?
I don't. Yes, I'm getting you.
Okay, and the fact is that you told me that you do drive. What we would suggest you that you should inform the driving license authority in this regard.
Okay, no problem.
And apart from this, John, is there any issues? If you suddenly feel like you have any weakness in any part of your body, you just come right away. We'll be there to help you out. Okay?
Yeah. Okay. Like, will Miner will do weakness?
Yes. I want to mean by that if you have any weakness in any part of your body.
No. Like Miner wouldn't do any weakness in the body. Why you are telling about weakness?
I don't know. What should I safety net in this regard?
I always told you, just if you don't know, just tell if your symptoms get worse or you have any new symptoms, please contact us as soon as possible.
Okay.
If you don't know.
Then I will say this. Okay.
All right.
I will tell if you don't know safety net. Then say if your symptoms get worse.
Yeah, or developed any new symptoms.
Or develop any new symptom, then
please contact us as soon as possible.
Then please contact us. Okay. Thank you. Now give me the review.
All right. So I think pain, like pain, you have to, whenever patient mention about pain, you have to do Socrates. So if you just ask me about Socrates part, I would tell you this pain is dull aching and it feels like fullness in my ear rather than pain, but it's very annoying for me when it happens. So it's not true pain. And it doesn't need painkiller. You can just give the anti-sickness medication. It will help as well, the antihistamine. You asked me about, do you have any past medical history of any medical condition? Don't say past medical is medical term. Just say, do you have any medical condition? Do you have any are you having any medical condition, or do you have any chronic medical condition, if you mean like long-term medical condition, or do you have any long-term medical conditions? And you can name it, such as, for example, any problem. Yes, one more question about the medical condition. What do you mean by it? And you like when you ask about medical condition, you ask me about symptoms again, like cancer symptoms, fever, weight. So you ruined your structure. So you ruined your structure. So you have, and you forgot to ask me about balance problem. So dizziness is not necessarily I have balance problem. So you need to ask me about balance. And I told you.
And when should I ask about the eyes?
Huh?
When should I ask about the eyes here?
So always you can ask them just before the past medical history, but still, if it depends on the station. Sometimes I would just ask the patient, is anything, like, for example, I know this patient worried about this hearing problem. So I will say, anything in particular that's worrying you? So just about the concern. Okay, just to make sure I'm not missing anything before I finish my history of present illness. So if they brought any concern, I can analyze here. And before the management, you can say about expectations before the management. So is there anything that you are hoping we will do for you today, apart from this? Or regarding this hearing problem, is there anything maybe he wants to refer to specialist, whatever, so, or sick note, anything you are hoping that we would do for you today? You can ask it before medical history. So you can divide them, like they are not necessary to be all in one place. So you can, before the management, ask about their expectations and ask the concern in the history of present illness.
Okay, thank you.